to be able to apply what they are learning, to feed back into the response that they have themselves. And it is about, continuing to apply all of these measures. They will bring this under control, as all countries will, in applying all of these measures, and stay vigilant, stay strong. Continue to engage with communities, all levels of the community, listen to the community, feedback into your response and adapt. Be agile and adapt. Mike?
Yes, and we are, I know Dr. Tedros has been in touch directly with very senior colleagues in South Africa, and we're working with our regional office on providing surge support, further high-level technical assistance to support South Africa in its response. I think we also need to remember that South Africa got its first cases quite early, and it's in a later stage of development of this pandemic. And the disease, when it came into South Africa first, tended to come into at the beginning into wealthier areas, and now has become very much established in poorer areas and townships and rural areas. So therefore, South Africa is experiencing that acceleration. But it's not accelerating any faster than many other countries in Eastern and Southern Africa, all over Africa. In fact, the South Africa numbers may be large, but they've only increased about 30% in the last week. But if you look around the region, in the same time, although the numbers are smaller, Kenya's increased 31%, Ethiopia 26%, Madagascar 50%, Zambia 57%, Eswatini 32%, Zimbabwe 51%, Namibia 69%, and Botswana 66%. And even though the numbers in those other countries are smaller, I think what we're starting to see is a continued acceleration of transmission in a number of countries in sub-Saharan Africa. And I think that has to be taken very, very seriously. South Africa may unfortunately be a precursor. It may be a warning for what will happen in the rest of Africa. So I think this isn't just a wake-up call for South Africa. This really is, we need